custody arrangements. Ross?
Thank you, Dave. It is 18 minutes after 8, and this morning Senate negotiators resumed their talks on health care reform, hoping to salvage a deal. 3 Democrats and 3 Republicans will negotiate by conference call. Meantime, members of Congress continue to hold meetings with their constituents across the country, and Democrats now say if Republicans refuse to work with them to pass legislation, they may just go it alone. With their majorities in both the Senate and the House, Democrats could pass a health reform bill without Republican support. Congresswoman Jackie Speier joins us live this morning from San Mateo. Congresswoman, good morning.
Good morning, Ross.
I have a quote here from Senator Arlen Speier. He says, "There is more anger in America today than any time he can remember." Do you agree?
Well, I don't know if it's anger or if it's angst. You know, everyone is worried. They're worried about losing their jobs if they haven't already lost their jobs. They're worried about holding on to their homes and their mortgages. It's just a very difficult time because people just don't know what tomorrow is going to bring.
And they're worried about their health care, and if they do like their health care, are they going to lose that? What is the number one question you're asked in your town hall meetings?
Well, people don't have a lot of the right information, and so part of my job is to make sure that they are informed so they can really come to a conclusion about whether they support healthcare reform or not. From my perspective, it's hard not to support healthcare reform because the costs are going through the roof. The amount of care is starting to be reduced. There's 14,000 Americans every day that lose their employer-sponsored health insurance.
But you know people are worried about losing what they already have, and maybe because of the stimulus package and, like you say, the economy, they're worried about keeping their job, that we're going to throw out the baby with the bathwater, and we've got some good things in the health system, and they want to keep that.
And I don't think this proposal does anything to take away those good things. What it really does is build on those good things by getting rid of some of the really egregious behavior by insurers. And it's important to note that health insurers, for the most part, are for-profit institutions. The 2 here in California that are nonprofits are Kaiser and Health Net. But for the most part, they are for-profit. So their first allegiance is to their shareholders and making a profit. So that means squeezing the costs out of the system, and that means reducing the care. So the issues around things like rescission, where the individual has been paying their premiums and all of a sudden they have a horrendous health care condition, and the insurer comes in and says, you know what, you didn't fill out your application correctly, and we're going to rescind your coverage. 20,000 Americans have had their health insurance rescinded, even though they were paying their premiums.
I mentioned
the other.
Oh, let me just interrupt, only because of a time thing here, Congresswoman. I'm mentioned in the story before I introduced you, Senate negotiators, 6 of them, called the Gang of 6, are negotiating by phone today. They're continuing to talk about health care, headed up by Republican Charles Grassley, who in the Washington Post this morning says, maybe we should have a narrower measure that Democrats and Republicans can agree to get this thing going, and maybe not scare so many more people, and make some changes in health care. Do you think it's going to shake out that way?
I don't know how it's going to shake out, Ross, because you know the devil is always in the detail. Everything always starts big and is reduced down to a smaller entity. But the one thing that we really need to stay focused on is making sure that the maximum number of Americans have insurance. And the only way you get there is by making sure you also have cost containment. So we want to make sure there's quality, there's access, and there's cost containment.
Well, I know this is very important to you, and you've always been a consumer advocate, and we wish you the best. And
thank you.
And answer those questions at those town hall meetings. Thank you, Congresswoman Jackie Speier. Time now is 8:23.